welcome back to this TrueFem video series. Today, again, joining us for the second time, I have my really good friend, Leah Gagan. I'm going to introduce her in just a second. But first, I just want to say that this video is being recorded for educational purposes. And there's a lot of really interesting things we're going to talk about today related to PMS and bleeding and all those questions that you've been throwing at us lately. So we're really excited to talk about it. But I just want to say that with a caveat that if you have particular questions about your own situation or whatnot, we want to encourage you to seek guidance from your provider. And again, this video is for educational purposes, but I hope you guys learn a lot. This is going to be a rich conversation. And again, I'm excited to have my friend, Leah Gagan. I want to introduce you because you have quite the bio, Leah. So give me just a second, flatter you a little bit, then we'll get into some questions here. So Leah is a board certified adult primary care and functional medicine nurse practitioner who helps individuals overcome chronic illness and achieve optimal wellness by naturally balancing the body, restoring chronic illness, and achieving and alleviating pain. Through her healthcare company, Emergence Health, which she started, she blends Western and Eastern medicine practices based on patient preference, evidence-based data, and her clinical expertise. Her assessment methods are scientifically proven and rooted in understanding a person's story, actively listening, and detailed lab testing. Leah's practice of medicine draws on over 6 years of experience working in both acute and primary care settings throughout New York, from NYU to a private Manhattan functional medicine practice. Her practice offers in-person care in New York and Pennsylvania and telehealth from anywhere in the US. So Leah, thank you for being here. This is such a treat for us.
Thanks so much for having me again, Sarah. It's always fun to talk to you, especially about some of our favorite topics in female health.
Yeah, today we're talking about two topics that when I first started TrueFem community on Facebook, these are two topics that women were really excited to talk about. And as I've been posting things and whatnot, you realize how many people are impacted by both PMS and bleeding, right? And there's a lot of questions around this in our lives of like, what's normal, what's not, what should I put up with, right? And what kinds of questions should I be asking my doctor? And how can I advocate for myself? Because what we have found, you and I and a lot of women in this community that we're building, is that there's an alternative approach that might not be as widely known to approaching some of these women's issues. So today, I think it's going to be really powerful to talk to women and or you and I talk and be able to educate people a little bit on what can they do about some of the things that they're experiencing. So yay, I'm excited. So let's just dive in. We're going to start with PMS first, and then we're going to talk about bleeding afterwards. So PMS, our best friend. As our hormones change at the end of our cycles and we're approaching our periods, it's normal to have some symptoms as our body is adjusting to hormone fluctuations. But some women, especially in our group, experience PMS for days, even a week or two leading up to their periods. So I guess the question for you, Leah, is what are the classic symptoms of PMS? And when are those symptoms considered to be normal versus a possible indication of a hormone imbalance?
Absolutely, Sarah. Great way to start. So, and I'm sorry if you hear like the torrential rain that's happening around my home right now. Please let me know if it disrupts what I'm saying.
Yeah.
But I feel like a lot of the symptoms of PMS people can resonate with or they've heard before. They're usually divided into emotional and then physical symptoms. So emotionally, people will experience tension, anxiety, depressed mood, sometimes crying spells or just feeling off, trouble falling asleep, and most notably changes in appetite too, having cravings for certain foods or eating more than they normally would. And also changes in libido, not having as much of a sex drive as in other parts of your cycle. And then some physical symptoms people will experience is, of course, number one, cramping is pretty popular and big. Popular isn't the right word to say. Most common.
It's common. Yeah.
Acne is also a big one. Bloating. Sometimes people will experience diarrhea or constipation, changes in their bowel habits, breast tenderness, and sometimes even alcohol intolerance and headaches. Some women get hormone-induced migraines. So around the time they ovulate or right before their period is the time when the hormones change and it triggers a migraine for some people.
Mm-hmm. And what are these symptoms? Like you just gave us kind of like you said, the emotional symptoms and then our physical symptoms. So is there a time that these are considered a normal part of our hormone fluctuations? Or at what point do we consider them to be, again, that imbalance point where you're like, something's a little wrong here?
Yeah, great question. So the definition of something being like wrong is usually when it affects your daily life and the way that you live. So if it becomes debilitating to your daily activities, it's definitely something that requires attention. But I'm really of the belief, and functional medicine has also taught me this, that any form of PMS, even though it's common, does not mean that it's normal. So even though many women experience symptoms of PMS, if our body is in optimal balance, even when we're dealing with shifts in our hormones that occur naturally throughout the cycle, you should not be really experiencing severe debilitating symptoms. And that's part of why we're going to discuss this in more detail today, to really unpack why some of these symptoms happen and what you can do to diagnose and treat them.
Yeah, because it's so interesting how many of us women have been programmed to think like, when that week of our right before our cycle or when we start bleeding, that is literally a week we dread, right? Like we get to this point in life where our life kind of revolves around it if we're naturally cycling. Like you just withdraw and you watch Netflix and you can't function. It's just like that's what we've accepted as kind of a normal course, which obviously what you're saying and what we know is not, right? Like that's not necessarily a way that we want to live our lives. So, what are the most common reasons women experience PMS symptoms? And how might a hormone imbalance be diagnosed using a functional medicine approach like the one that you use?
So, I'm going to answer this question in two ways. One way, I'm going to just detail what could be happening in the body at the hormonal level. And the other way, I'm also going to describe it is through typical diagnoses or terms that we use to describe some symptoms around period and hormonal irregularities around menstruation. So two of the main reasons or the main shifts that happen that can cause PMS symptoms are estrogen dominance, which means your estrogen levels are higher than progesterone levels in the body, because estrogen is associated with weight gain, with breast tenderness, moodiness, trouble sleeping, heavy periods, and also fibrocystic breasts, which basically mean if you're palpating your breasts around your period, they feel lumpy and bumpy, almost like oatmeal, instead of smooth. So those are all attributed to high levels of estrogen. And unfortunately, in our daily society, we live in a toxic world where we're exposed to many things called xenoestrogens, which are different chemical exposures in our environment that mimic estrogen in our bodies. So our body sees them, thinks that they're part of our hormones, and then regulates and adjusts according to them. And these can be in things like personal hygiene products, cleaning products, different chemicals we're exposed to on a daily basis. Even from an early age, they're noticing that women, young girls, are getting their period earlier and earlier. It used to be around 12 to 14, but now the average woman gets their period a little bit younger, like around 10 or 11. And they're attributing that shift to the exposure to these hormonal disruptors earlier on in people's lives. So that can be a big problem. Another reason chemically that people can get PMS symptoms is when their estrogen and progesterone are not in balance. So after you ovulate, your progesterone should start surging during the luteal phase or the second half of your cycle. And then when progesterone goes down, that's what triggers you to have your period and have your menstruation. So many times after women ovulate, even if the progesterone is going up nicely, if estrogen is not going down in accordance with it, that discordance between those two hormones can also trigger symptoms. So part of the functional medicine approach for treating and diagnosing hormone imbalances is to actually look at those levels during different parts of your cycle and see how they match up and see how they correlate with the symptoms you're experiencing. And then some other things, I guess, moving towards more of the diagnoses and the medical terms that we'll use to describe some issues with PMS A lot of women experience endometriosis. Around 1 in 10 women during their reproductive years will have endometriosis, although not a lot of people get diagnosed with it, unfortunately. We don't really have the greatest way of screening people for this yet. But basically what happens with endometriosis is there's an overgrowth of endometrial tissue, the lining of your uterus, in places where it shouldn't be. So it'll grow on parts of your ovaries or parts of your abdomen, and it can get very sticky and attach parts of your reproductive organs that should not be attached together. So a big side effect of endometriosis could be period irregularities, so not having a consistent cycle, pain with sex, and a lot of severe cramping with cycles. And then lastly, people have probably heard of polycystic ovarian syndrome, PCOS. This is a syndrome that is characterized by having either cysts, different cysts that grow on your ovaries, or high testosterone levels in your body. So what happens with PCOS, people also have irregular periods, and many women will have trouble with fertility related to PCOS.
So from a functional medicine standpoint, if one of our ladies came to you and was like, these are my PMS symptoms, this is when they start, how would you start with them and treating that? Like, how would that look from your approach to medicine?
Great question. So first, I will try and assess whether or not they're on any forms of hormonal birth control, because it can be very hard to tease out what is going on hormonally in the body when the birth control is masking what your hormones are naturally doing. And it could actually be a huge trigger of the symptoms. So before I start to truly treat the root cause, I need to clear out anything that could be blocking the way. So I do try and counsel my patients on alternative methods for contraception, if that's what they're interested in, and try and wean them off of hormonal birth control so we can really see and understand what their natural hormones are doing. Mm-hmm. And for many women, that actually ends up fixing the problems. But for other women at that point, we would go in and do testing, which could be two things. It could be actual like blood work or chemical testing. I use a test called the Dutch test that looks basically at your urine metabolites of different hormones to see how your body creates the sex hormones and eliminates them in the body. Or on top of that, we also have them do cycle mapping, which you teach to your clients, because understanding where in their cycle they're at when they're experiencing symptoms and what their temperature is doing and their cervical mucus also allows us to have more data points to more accurately assess what's going on inside the body.
Yeah. It's interesting because I teach teenagers how to chart their cycles, because how often, I'm sure you see many patients that they got, went into their doctor as a teenager with these symptoms, PMS symptoms, heavy bleeding, cramps, like their whole life was kind of disrupted around their cycles as teenagers, and they're put on hormonal birth control or something similar. And then, I think one of their big fears is that when they come off of it, they'll experience those symptoms again. And it's likely, right, to some degree, because we've treated symptoms, but not the root cause. So I think what's cool about functional medicine, and obviously why I teach what I teach, is to get to the root cause of the problems so that women can heal their bodies, right? It's not just working on symptom management. So speaking of teens specifically, since again, I have a love for teens, and I think teaching body literacy to teens is really important. But the teenage years is where a lot of them start to feel these symptoms. Do you have any recommendations for that age group specifically on ways that they can support their reproductive health as their bodies are getting into the rhythm of actually ovulating normally?
Yeah, really great question. This can be a very confusing time for teenagers, right?
Mm-hmm.
Their bodies are going through so many shifts, and there are things that you might not understand, and it's hard to understand and know what things are considered normal or what things that you need to speak to somebody about and who to actually speak to about these changes when every person is going through these changes at a different pace than you. Mm-hmm. So I think that it's really incredible what you're doing, Sarah, with teens and being a trusted resource for them. For younger clients who are looking to balance their hormones, I do lean heavily on diet as a way to change our hormones. Diet is rich in different vitamins and nutrients that are essential for healthy ovulation and healthy menstrual cycles. You might have heard of seed cycling before. It's gotten a lot of popularity recently. But essentially, it's cycling through different seeds, different nuts and seeds like pumpkin, flax, sesame, and sunflower during different parts of your cycle. And what those do is they actually provide nutrients that help to support that part of the cycle, which is pretty fascinating.
Yeah, that's super fascinating. I actually didn't really know about seed cycling until I honestly became an educator and learned about it. And how long, following this recommendation, how long do you typically recommend somebody to do it before results, before they might feel a little decline in their PMS symptoms or their cramping and whatnot?
Yeah, so when you're dealing with diet and exercise and supplements, some people will feel a blip of benefit right away, but other people, it is very normal to have to go through a couple of cycles, probably around 30 to 60 days before you start seeing a true benefit from it. And that's because we need to give our body enough time to build up these nutrient stores in your body and allow them to influence your cycles in a positive way. So patience is important when it comes to dealing with things more naturally.
Yeah. Well, and that's a mind shift, right? Because for so long we've been used to going to the doctor and getting a pill, or going to the doctor and have like a treatment plan that's within the next week, versus making these subtle changes to how we actually live our lives to positively impact how our body is functioning. That's a total different way of looking at health, right?
That's exactly it. Yep.
Yeah. And
Tracking cycle is one of the best ways to do that first, is to just get in touch with your body, understand what's normal for you. Because today during our talk, we're going to speak about a lot of averages of what we've seen in the literature. But just because that's the average does not mean that that's where your body feels comfortable. And that's okay, so long as you feel okay where your set point is.
Yep. You being the best advocate for that, right? I think that's so powerful. Is like when women know, like, this is my normal, right? This is where my body is best optimized, and being able to use that as a point to jump from when you're seeking care is really, I think, empowering. So let's go back, because you often speak to natural stuff, which is super cool. And I think it's new for women, right? We don't always hear about the natural approaches for things. So for PMS symptoms, what else would you recommend from a natural standpoint that might help women?
That's great. So some of the things I found really helpful in practice that have a lot of data behind them, if you're experiencing a lot of cramps and also moodiness and trouble sleeping, magnesium is a great mineral to supplement with during your cycle. I usually have women dose it at night. There's a really great over-the-counter one called Calm, C-A-L-M, that you can get. Anywhere from 400 to 800 milligrams at night will help with cramping, help with sleep, and help regulate specifically anxiety if you're having that during your PMS. And then more on a macro view, I use an herb called chase tree berry. So your pituitary gland is this little tiny, it almost looks like a little punching bag that's in your brain. And what it does is it signals your ovaries to create LH and FSH, or it actually creates LH and FSH, excuse me, that then signal your ovaries to release eggs at certain parts of your cycle. So more of a macro way of balancing the hormones is basically allowing that pituitary gland to have a clear channel from your brain to your ovaries so they can communicate with each other in the best way. I describe birth control a lot of times to women as kind of a disruptor of that line between the brain and the ovaries. So an herb like chase tree berry just helps to strengthen that connection and allows the body to balance those hormones from the top down, which is great. And then more symptom management that's more natural than taking an Advil is castor oil packs are really great to heat up and put on your pelvis if you're having cramps. Saunas and exercise are really great for detox and helping with energy if you feel very sluggish during your period. It also helps to just open up your pores and get any chemicals out that could be leading to acne or to just not feeling great, feeling like crappy. And then depending, I wouldn't recommend trying these unless you've been diagnosed and you're being followed up by a provider. But for estrogen dominance, I use a supplement called DIM. which is an antioxidant found actually in cruciferous veggies. So vegetables like broccoli and Brussels sprouts that help to lower estrogen levels in the body. And then if you have high testosterone, which I mentioned is a big underlying cause of PCOS, there are different herbs and blends that you can use to help lower testosterone levels, like spearmint tea. Spearmint works really well to lower testosterone.
And it's kind of cool when you speak about this, because one of the things that I think a lot of women don't like is feeling like they're on medications or have to do something all the time, right? So what I love about some of these natural remedies, it's not like you have to do this every day, but if you're approaching your menstruation and you know it's coming, it's kind of nice to have some proactive things in your pocket that you can just make as a little bit of a habit, you know, that week before your menstrual cycle or a couple days before you know that you're going to start. You know, you can just be like, oh, time for magnesium before bed this week or whatever. You know, there's just little simple things you could do instead of feeling like you're tied to something that's a prescription, right? To always have to use it or whatnot. So I think it's kind of powerful, and it'd be kind of fun to hear from women who are watching this, if they try that, how that works for them. I always like to hear, you know, people who are actually doing this stuff, how it impacts them. So we talked about cycle tracking a little bit being, you know, one of those baseline things. Like that's a really good place to start when understanding your cycle and also correlating with some of the other issues that you might be experiencing. But for teens or other women that are experiencing really bad PMS and cycle symptoms, other than tracking their period or their cycle, what are maybe just a few little things that you would tell them that would be something they should be thinking about next?
Yeah, great question. So before I would even see a provider, I would collect some information on your own. So tracking your cycles, keeping a list of your symptoms and what seems to help or make things worse, whether it's stress or lack of sleep, like what actually influences how you're feeling the next day related to your hormones. And also like something that I feel like is so discredited in Western medicine that we don't usually put the time into to ask, that's so useful, is asking about family history. Because a lot of the way our bodies work are downloaded genetically to us. And it's fascinating to hear when I speak to women about cycle irregularities or early menopause, for example. Oh, do you have anybody in your family that have experienced this? And you'd be very surprised to see that there are many patterns that you can pick up with that. And that's really useful to know because our body is a balance of nature and nurture, and there are ways that we can influence both of those things. Just because you've gotten a gene from your family does not mean that that gene needs to be expressed in the way that your body works. There are ways to modify your genes through diet and lifestyle. So it shouldn't be discouraging if you see a strong family history of any of these things, but it really is important for us to know that as the providers, because it does tweak and adjust the way that we view treatment. And then some of the testing.
Oh, yeah, I think that, no, I was going to say, I think that's really fascinating because, you know, I think that we're getting better at this in our society as moms talking to daughters about their cycles, you know, but I think that there's been decades where that was a taboo topic or hard to talk about. You know, so if that was the relationship between you and your mother or, you know, the lady figure in your life, it's just interesting to loop back around to that as an adult, right? And to say like, let's talk about this for a sec and see if there is any correlation. And like you said, maybe some hope for modification then with diet and lifestyle. So
that's exactly it. Yep. It can be really empowering, you know. Instead of seeing it as something discouraging or something that you can't change, let's flip the switch on that and change the agenda and help people feel empowered to know that there are things that we can do and help support them with that can change that outcome for the better.
Yeah. Well, I think our second topic today really dovetails nicely with PMS because it's pretty common that women that have significant PMS symptoms also have significant bleeding symptoms, right? There's kind of this synergistic quality to those two different issues. So let's kind of switch gears a little bit and talk about bleeding because I have had a number of women over the past couple of months have texted, emailed, posted questions where they're like, is this normal, right? And trying to understand I hate to use the word normal, but I think we have to have some parameters in which to know if intervention is needed or not, right? There's a baseline where we say, okay, if you're kind of falling outside of this baseline, then we might need to look at this. And so just for women, when we say the word normal, just understand that we have parameters in which that we're looking at cycle patterns to help understand the hormones behind what's going on. So in FEM, which is a fertility awareness method we teach that bleeding is a biomarker. It's a biomarker of your health, and it really does communicate what the hormones were doing in your previous cycle leading up to that bleed. The quantity of bleeding, the flow, like how heavy it is, and even the color can tell us a lot about your hormones. So, Leah, when it comes to periods, what would you consider to be a healthy quantity and length of bleeding and symptoms during a menstruation?
All right. So the regular cycle, the average cycle for most women lasts 21 to 35 days. Now, to describe this, the first day of your cycle is the first day of your menstrual period. First day of your period is day number 1. So from that first day of your period to the day that you get your next one is considered a full cycle. So 21 to 35 days is considered normal for that. The average length of bleeding should be around 3 to 7 days. If it's less than 3 days, there might be an issue with estrogen deficiency, not having enough estrogen. If it's longer than 7 days, there might be issues with progesterone or issues with fertility that could be going on there. And anything greater than 7 days, by definition, is considered heavy bleeding or excessive bleeding. So really interesting there. And then also the color, as Sarah mentioned, biomarkers, nothing but that the body does is by chance. Everything is telling a story about what's going on in the inside and are kind of like little breadcrumbs or clues to tell us how your inside health is going, inside as well as your outside. So there are different colors of your menstrual blood that help tell the story of what's going on. So
and I'm sharing the screen, Leah, that of that little menstrual cycle or colors. Yep.
So we'll start, I guess, from the top. So black blood, which I have had a couple people have black blood. They get very scared. Could be the beginning or the end of your period. It could just be very dark old blood. Or dangerously so, it could be a vaginal blockage, meaning there could be a fibroid in there, like a dense mass of tissue that could be blocking and irritating the blood flow of the vaginal and cervical areas. So that could be a dangerous sign, especially if it's associated with things like pain. Gray discharge is related to a bacterial infection that's really common. It's called BV, bacterial vaginosis. That's usually treated with a suppository, so like a little gel cream of antibiotic that can go into your vagina and help clear it up. There also are some other like herbal and natural treatments that I'll use to treat BV in patients, like boric acid is an example that comes to mind. Orange blood is period blood mixed with cervical fluid or a possible infection that definitely requires being assessed, going to your OB or going to your primary care to get a swab done. Pink blood is usually period blood mixed with cervical fluid that makes it a little bit light. Or this could be related to somebody who's had very significant weight loss or an unhealthy diet or anemia where their body just doesn't have enough red blood cells circling around to make that blood a nice deep red color. And then bright red blood, fresh blood, and a steady flow, that's really the healthiest form of blood that we do want to see. We don't want it to be like super bright from experience. That means that it's kind of like going through your system a little too quickly. I kind of describe it as a mix between bright and maroon. Somewhere in between there is considered healthy. And then brown or dark red is the beginning or end of your period, or it could be early signs of pregnancy. And Sarah and I were also discussing offline before we hopped on here that sometimes spotting of brown blood after your cycle is supposed to be done could be a sign of progesterone insufficiency and a need to support that during the second half of your cycle.
Here, I'm going to stop sharing this. So we are back. That was really helpful, that visual. Like, I hadn't seen a visual like that before. So I know that was helpful for me and helpful for people watching this. So I will post this in our TrueFem community Facebook groups, so women have that for context. I think that's really helpful. Um, so going back to the quantity, I know that's always a question for somebody of like, how do we judge quantity and what's a lot and what's normal as far as how much blood flow that should look like?
That's true. And this is always a very subjective marker because remember, you're the one who has your cycle every month and knows what's a normal flow for you. So
Hmm.
anything that's off or deviates from that normal flow, even if that's considered within the normal range, is definitely something to bring up to your provider and to keep a close eye on because that's what's abnormal for you.
Hmm.
So for most women, they'll lose around 16 teaspoons of blood during a cycle or around 80 milliliters. But like, who is actually measuring with a measuring cup how much blood is coming out? I
Yeah.
think it's so silly that they give us the stats like this.
Hmm.
Um, the way I go through it with my female patients is I actually just go by different pads or tampons and how many they're going through in a day and whether or not
Hmm.
they're regular or super or maxi.
Hmm.
Helps me just get a gauge on where the flow is at. So anywhere from 2 to 4 pads or tampons per day is considered normal, and that should be spread throughout the day. Another concerning sign when I speak to women is if they're going through a pad or a tampon like every 1 to 2 hours during a day in a short amount of time, something might not be right. That's way too much blood to be losing in a short amount of time. And then pairing with quantity is also clots. So clots can be a little scary for women who don't know what they are. Clots are normal in the shedding of our uterine lining. We basically have tissue that builds up along our cervix that progesterone helps to build up. Because if you have an egg that gets fertilized during ovulation, that egg will then embed into that nice fluffy uterine lining. Think of it like a nice comfy pillow or like a goose feather down blanket. And it just helps it stick and gives it nutrition so that it can grow into a baby, into a little embryo. So what happens is when you're not going to have a baby, that is what sheds and comes off sometimes in clots during your cycle. So the way I describe clots to women is having a couple little clots are okay and totally normal. But if you're having clots that are bigger than the size of a quarter and you're having them multiple times, or sometimes I even had a woman once who had one the size of a golf ball. She took a picture of it and sent it to me because I was like, really? She's like, yes, really. It's so powerful that we have our phones now, that our providers don't always have to be there in the moment when something happens. If something is really out of the norm for you, take a picture of it, save it in a
Hmm.
secure place, and share it with people that can help you when you're able to get to them. But anything greater than that quarter is also considered abnormal and needs to be investigated.
Yeah, I think that's really powerful because I had a patient recently who, had really normal cycles and all of a sudden a big change in life and heavy, heavy bleeding, clots and whatnot. So obviously that's a very dramatic shift and, her normal pattern for her. But I think going back to what you said is that you're the one paying attention to your body every month. So if there's a deviation from your normal and it keeps happening, right? Or there's like something odd, like you're saturating a pad or a tampon in 2 hours, or you're having clots and you never did before, like that certainly warrants some medical follow-up. Like, what's going on in there? So I guess that kind of leads really well into our next question, because I think some women, not all, but some experience with the traditional medical community has been, maybe not taking women seriously with these concerns, or not investigating the root cause of the issues that might be causing some of this bleeding. So, what warning signs might a woman experience before and during her period that would concern you as a functional medicine practitioner? And how would you go about investigating those issues?
Yeah, a couple come to mind for this question, and sometimes they'll pertain to you, and sometimes they'll be for later on in your life or earlier on in your
Mhm.
life, because as our bodies change, there are different risk factors we have to look out for. So, in my women who are postmenopausal, meaning that they haven't had any bleeding for over a year, that means that they're after their menopause, um, or in menopause,
Mhm.
postmenopausal. If they have any breakthrough bleeding or spotting, that is considered abnormal and requires an assessment. Usually I will do a transvaginal ultrasound to see what the source of the bleeding is. And that usually requires deeper investigation because that could be a sign of something like cervical cancer. And then for women who are having regular cycles, something that is scary to mention, but very important that we don't do a good job at educating people on is ovarian cancer. And ovarian cancer, unfortunately, is a silent killer of a lot of young people because it has very non-specific general symptoms when it first comes on. So I'm going to list a couple of them just so that you can keep these on your radar. So severe bloating or changes in bowel habits, severe pain, irregular bleeding, unexplained weight loss, or changes in appetite, usually appetite loss. A combination of these different symptoms requires a rule out of ovarian cancer. And the way that would be done is also through a transvaginal ultrasound to see if we see anything on imaging. So it's pretty non-invasive and a really great way to just keep an eye on what's going on. So whenever I have a worry like that, or it's somebody new that I'm seeing with symptoms, I do err on the side of caution and do those tests. And then if somebody's having heavy bleeding, I've had a couple of women who have had this. We talked about the fancy word menorrhagia before, which is bleeding more than 7 days or having more than 80 milliliters of fluid a cycle. And the way that I actually diagnose that is if somebody is saturating more than 1 tampon or pad every 1 to 2 hours, or having a lot of those big clots greater than the quarter size, are things that run on my radar for issues with too much bleeding. And the reason why that can be very dangerous is if you lose too much blood, then you don't have as much blood in circulation. And it can lead to things like dizziness or electrolyte and fluid imbalances that can make people feel faint or have intolerance to exercise, get short of breath easily. So usually I'll do an ultrasound to see why that's happening if somebody's having heavy bleeding. One of the big causes of heavy bleeding that we haven't actually talked about before are fibroids, which are growths buildup of tissue that stick to the inside of your cervix or your uterine lining. And depending upon where they are, they can be painful. Fibroids are an estrogen dominant tissue. So it usually is associated with excess estrogen that it can cause this heavy bleeding. So definitely something to look out for. Unfortunately, if some women have had miscarriages and they haven't had all of the tissue from that miscarriage come out of their body naturally, and if some of it's still in their body, that can also cause severe bleeding and can be very dangerous. That would require somebody going to the emergency department to get that cleared out. And the way that I treat heavy bleeding outpatient is usually most women will do well with just oral rehydration, drinking lots of fluid, and not just water, but things that have electrolytes in them, like coconut water or salt water, to help pull that fluid back into your vessels to keep your blood pressure up and help with circulation. I will always start an iron supplement on somebody because if they're bleeding that much, even if you don't see it in their blood work yet, they will become iron deficient. So I do supplement with iron and encourage iron-rich foods in people's diet. Things like green leafy veggies, red meat, eggs, certain nuts and legumes. And then sometimes I will have to use different herbs or medications to treat it too, especially if it's very severe. One of my favorite herbal blends that works really well is using red raspberry tincture and chaste berry. And you take 20 drops twice a day. Stops the bleeding within 2 or 3 days most of the time for women, which is incredible.
I'm sure nobody has ever had a doctor tell them that before. I sure haven't.
And there's a lot of data on it too. Yeah, it's really great. And then another thing, I mean, if we really wanted to stop it and use a more traditional method, we would give people oral progesterone, because progesterone, remember, that goes up after you ovulate and should go down to trigger you having your menses. So if we boost up progesterone, that should actually shut off the bleeding. And that usually is a higher dose of progesterone than I would use just to boost up the second half of your cycle. And some women do have some side effects from that. So I don't usually use that as my first treatment if I can help it.
Yeah. Yeah. What about women who might be noticing that they're skipping periods?
Yeah, so skipping periods is another warning sign for sure.
Hmm.
Um, it can happen for many different reasons. A lot of times, severe stress, which increases cortisol, a stress hormone in our body, will actually shut off your
Hmm.
cycle. And our bodies are just so smart. It's really incredible. Because think about it. If you're really stressed, or like back in like caveman days, if a saber-toothed tiger was running after you, and you were stressed and you were running away and your cortisol was high, that is not the time to have a baby or have to deal with like bleeding during your menstrual cycle. So our body just shuts that process off because it has better things to do and it needs to keep
Hmm.
us alive. That's like priority number one.
Hmm.
So stress can be a big trigger that influences your cycle and can stop flow. Um, and another one that can happen is more of a physical stress. And that's when women lose weight very significantly, or women who have eating disorders like anorexia or bulimia. At times, that can also shut off the body's ability to have a healthy cycle, and they won't get their period.
Yeah.
So, really treating the underlying cause with skipping the periods, working on increasing healthy weight through building muscle, eating healthy fats, managing stress. I do a lot of meditation teaching with people. Adaptogens, which are herbs that help to regulate your stress hormones, can be very helpful. Um, and in a way, I kind of describe it um, inducing a period for some people when they haven't had one. Using progesterone, using it and then taking it away will induce one. You'll appreciate this, I guess. Comparison, Sarah, is kind of like a cardiovert for your hormones.
Hmm.
Uh, so, like if your heart stops beating or if it's an irregular cycle, you just use a little zap, and it helps to get it back into a rhythm.
Yep.
Sometimes that can also help with women who haven't had their periods, kind of
Hmm.
inducing one, helping to show the hormones the path to go. And usually the body will try and follow suit.
Hmm. I love that. Cardioverting your hormones is perfect. The other thing I think, just to add on to that, everything you said was just really helpful. And when women are charting, I think I love as an educator watching the light bulb come on, where they're charting their cycles, they see these heavy periods. And typically, a heavy period is not the only symptom in the cycle, right? There's usually other patterns that kind of expose themselves in the cycle when you start charting in a standardized way that might enlighten you to like, okay, so my period is one way my body's being like, hey, something's up. And then you might see patterns in other spots in your cycle that are also kind of helping illustrate this issue that needs to be discovered. So I think that's really powerful. And one of the things that we've talked about in our previous videos too with functional medicine or this approach is it takes a little time and it takes a little bit of effort on our parts to pay attention to record those things, right? And then I always encourage my patients to write those symptoms throughout their cycle in the notes. Like take good notes about your body during your cycle, because all of those things, even though it might seem insignificant, like, I had cravings or bloating or my right side hurt this month during ovulation or whatever, all those are little clues, right? It gives you, the provider, a really nice storybook when they come see you with all this data that they've been collecting about themselves. And the data doesn't lie. It really does tell a good story.
It totally does. The best way I describe my job is as a medical translator, because these big fancy words and what goes on in the body can be so overwhelming to understand sometimes. But I do believe that my patients and people who are sick, people that live with their body every day, they
Mhm.
know what's going on with their body. They can articulate the symptoms they're experiencing. And my job is to take those words that you're telling me of what's going on and explain them to you in a way that explains what's happening medically. So that
Mhm.
when this happens again, you understand what's going on the inside and not just the symptoms.
Yeah.
And just even that simple knowledge can be so empowering and just help you make those steps, those first little baby steps towards correcting the issue before you
Mhm.
even get to see a provider. It makes
Yeah.
you basically like your own provider in some ways.
Yeah, and it's a fun way to look at medicine differently as a collaborative process versus me going to receive an answer from somebody, right? There's this collaboration that takes place when you are collecting data and sharing it with a provider who uses it as part of the process of diagnosis. I think that's really powerful. So just to wrap up, Leah, I just have like two little questions here for you, but are there any recommendations that you would suggest for women listening to this that are currently struggling with really difficult periods? Like couple takeaways, what would you have them? What would you want to say to them?
All right, let's summarize. So charting, starting to chart your cycle, take really good notes on your symptoms, start to piece the puzzle together yourself. Working on your diet, absolutely. We talked about different ways to help boost and support ovulation and your hormones during different parts of your cycle, like seed cycling. Very simple things that you can do that can make a really big difference. Um, Listening to your body. It's okay during your menses to need to take things easy, to need a little bit more sleep, to do a little bit more self-care than you're used to take it easy on your exercise routine. And I think we need to allow ourselves a little bit more of that forgiveness and be more intuitive with what our body needs, and be okay with that. Embrace it and give the body what it needs if you realize that you're needing that extra rest. So those are just some simple things. And then also finding a provider if that's not helping, somebody that can really understand you, that you feel comfortable with, that will help you unpiece this puzzle and figure out exactly what's going on at the root cause to help reverse the symptoms you're experiencing.
Mhm. So, are there any resources that you'd like to just kind of get our listeners interested in as we finish up this video? Anything that you would recommend that would be a good point of learning if they're interested in more on this topic?
Yeah, so some of my favorites to look at, there's a woman, Alyssa Beatty, who has a whole program called Flow Living. She's written books about diets to help regulate your flow. She has videos. I think she even has a podcast, very helpful. And then I mentioned on our other talk, Jolene Brighton.
Mm-hmm.
I really trust and recommend her videos and her book, Beyond the Pill. Even if you're not on birth control or haven't been, it's still a very helpful read on how you can balance your hormones naturally and what different symptoms actually mean with what's going on inside. And they also provide different steps to get started with diet and exercise and different foods and recipes to try,
Yeah.
and jumpstart the process yourself.
Okay, and last but not least, you need to tell us your Instagram so that we can all go follow you, and then also how people can find Emergence Health, which is your healthcare practice.
Yeah, sure. So if you liked what we talked about today, and you want to get more of a personalized perspective on how I can help you with your hormones, based on your specific symptoms, I'm happy to do a free consult. I do 30-minute free consults with patients about their health concerns and what it would be like to work together. So my company website is emergence.health. And there's a link on there to schedule the free consult. You can also reach out to me via Instagram. My Instagram handle is just my name, @NP Leah Gagan. And we'll probably write out the spelling of my last
Yeah, I'll
name
put that on there.
somewhere on here. It's a Gaelic last name, lots of silent
Yeah.
letters.
Yeah. I'll make sure that's on our video description. But I learned a lot. I'm an educator, I'm a nurse, and I love these conversations because I learn every time we have them. So that's really cool. So I appreciate your time. And again, I know lots of women who need this information right now. So I think this will give a lot of people hope that there's proactive things we can do as patients and individuals to really harness our health and have data to do something with. So I think that's really cool. So thank you for empowering us and giving us tools. And I will selfishly be looking forward to the next time I get to have you on. And we'll, of course, have some other burning topic that women want to know about. If you have a topic of interest and you're watching this video, please write it in the comments wherever this video is posted and you're watching it, so that we can create more content that's of interest to you. So again, thank you so much, Leah. This is always a joy, and I look forward to these so much, and I'll be excited to have you join us again.
Me too, Sarah. You're welcome.
All right, thanks.